host Rich Vernadeau, featuring a true crime case.
Welcome to the True Crime Show. I'm your host, Rich Vernadeau. Tonight's episode is dealing with an extremely bizarre case. A serial killer male nurse in Germany who may have claimed as many as 100 lives, authorities say. Prosecutors are convinced he's killed at least 86, and they think the number may reach as many as 100. He was convicted of murdering 2 patients through overdoses of heart medication. Throughout his career, prosecutors revealed recently. This male nurse's name is Niels Hogel, 40 years old. He was convicted back in 2005 in the deaths of 2 people and an attempted murder of 2 others at a hospital in Delmenhorst, northwestern Germany. Hogel was subsequently sentenced to life in prison, but after that, prosecutors have uncovered more people that they believe he killed. They're speechless. John Kuhn, the police chief in Oldenburg, has stated the number's at least 84 killings. As if that were not enough, he went on to say, we must realize that the real dimension of the killings by Niels H. is likely many, many times worse. Kuhn said Monday they began investigating after Hegel was convicted of an attempted murder in another case. The deaths of hundreds of former patients in Oldenburg and Delmenhorst were then investigated, leading them to uncover more evidence of about 84 other killings that he had not yet been convicted of. They've chosen authorities not to release the identities of the 84 people. But he said the number of actual murders is likely much higher, because many victims were cremated, making it now impossible to uncover the necessary evidence. Hogel worked at the Oldenburg Hospital from 1999 to 2002. Then he went on to Delmenhorst from 2003 to 2005. He even admitted during the trial that he enjoyed the feeling of being able to resuscitate his patients when they went into cardiac arrest. Kind of a Munchausen syndrome by proxy. He told investigators he killed patients in Oldenburg and brought about 90 patients to cardiac crisis. Kuhn blamed local health authorities for failing to contact the necessary officials whenever they suspected something was going on. Medical co-workers' suspicions about Hogel trace as far back as April 2003. Then they noticed there was something wrong with the large number of resuscitations. If the people responsible at the time, particularly at the Oldenburg Clinic, but also later in Delmenhorst, hadn't hesitated to alert authorities, Hogel could have been stopped earlier, Kuhn said, had they just simply notified police and prosecutors.